Good afternoon, everyone, and welcome to today's informational session on the special emphasis notice for applicants to address development and testing for data sharing functionalities to support clinical care, research, and improved healthcare outcomes under the LEAP and Health IT NOFO. Today's agenda includes an introduction of speakers, reminders and housekeeping, an overview of the special emphasis notice, and the background on the LEAP, the Leading Edge Acceleration projects in Health Information Technology, or Health IT. Then we will continue with an overview of funding, eligibility, and application information, as well as application responsiveness and the merit review criteria. Before closing out the webinar there will be additional time for you to submit your questions at the end of the presentation. Today's speakers include Ms. Tracy H. Okubo, a program analyst with the O&C Standards Division, Ms. Yolanda Thompson and Mr. Tavon Taylor, Grants Management Specialist with the O&C Procurement and Grants Division, and myself, Derek Ware, your moderator. A couple of housekeeping items before we begin today's event. This webinar is being recorded and will be made publicly available. All lines will be muted during the presentation. If you have questions, please enter them into the chat box. All questions will be answered in the form of an FAQ and be made publicly available each week. Webinars and FAQs will be available at healthit.gov under O&C funding opportunities. To ask a question during today's event, please use the chat box function. Please find and click the chat button on the bottom of your Zoom webinar window. The Zoom group chat window will expand on your screen. Type your question into the chat box and hit enter to submit your question. If you have additional questions after today's webinar session, you can send them to the following email address, onc-leap@hhs.gov. Again, that's onc-leap@hhs.gov. I will now hand it over to Tracy to provide more detail on the special emphasis notice for applications under the LEAP and Health IT NOFO. Tracy, the floor is yours.
Thank you, Derek. Good afternoon, everybody, and thank you for joining us. This is an informational session on the special emphasis notice for the LEAP and Health IT Notice of Funding Opportunity, looking at applications that address development and testing for data sharing functionalities that support clinical care, research, and improved healthcare outcomes. This year, we actually have 3 areas of interest. There will be one award, or we anticipate to have one award per area of interest. There will be a maximum of $1 million per award for areas 1 and 2, and $500,000 for the area 3. The period of performance for this special emphasis notice award is 2 years. Applicants may, however, propose an additional 3 years for up to a 5-year total of work, which would be subject to availability of funds and meaningful progress. Letters of intent for this year's SEN are due on April 27th, and applications are due by June 8th, 2020. Next slide, please. So this year's areas of interest: Area 1, advancing registry infrastructure for a modern API-based health IT ecosystem. Area 2, cutting-edge health IT tools for scaling research. And Area 3, integrating healthcare and human services data to support improved outcomes. Please note, you may apply for all 3 areas of interest. However, if you intend to do so, you must submit a separate application for each area of interest that you are applying for. Applications that address more than one area of interest are not going to be considered or will not be considered for award. Next slide, please. So Area 1, Advancing Registry Infrastructure for a Modern API-Based Health Ecosystem. As mentioned earlier, we anticipate issuing one award up to $1 million. The goal here is to advance the use of FHIR-based APIs for all aspects of registry data submission and use of data from registries, with the goal of decreasing data acquisition burden for all participating entities, reducing data normalization and standardization efforts, and ultimately providing providers with timely access to data for analytics and actionable knowledge. Next slide, please. The associated objectives of Area 1. Area 1 recipients must identify the clinical registry or registries that will be used by their project. Note that applicants selecting this particular area of interest must include a letter of commitment from the clinical registry or registries that they intend to partner with for purposes of their project in their application. Area 1 recipients must also utilize a HL7 FHIR-based standards-based approach based on the prior Coordinated Registry Network, or CRN, Implementation Guide, IG, to support submitting and accessing registry data. They must identify and implement FHIR resources that are suitable for exchanging with the identified registries. Use the bulk data access ID to perform efficient data submission and access for group of individuals. Ensure that the APIs are used for accessing data for a single patient and for a population are being secured using appropriate security standards such as the Smart App Launch Guide, Back-End Services Authorization, and the OpenID Connect Core 1.0, which incorporates the Errata Set 1. In the case where gaps are identified and/or improvements or modifications are made to the Women Health Network CRN IG, Bulk Data Access IG, or other implementation guides that are used or impacted under your project, the applicant will be required to document these actions and other implementation specifications to support their chosen use cases. Applicants or recipients will also be required to document best practices in implementing the standards and implementation guides in support of their chosen use cases. And they must coordinate with the appropriate standards development organizations to ballot and adopt new and/or updated standards and/or implementation guides that result from this project. Next slide, please. Finally, Area 1 applicants. Required expertise. We are looking for applicants that have expertise in registry data submission and the use of data from registries. Applicants that are familiar with the data acquisition burden for providers using registries. HL7 FHIR standard and balloting of standards in HL7. Familiarity or expertise in implementation guides, including the CRN IG and Bulk Data Access IG. And finally, the Smart App Launch Guide. Area 2, Cutting Edge Health IT Tools for Scaling Health Research. We anticipate issuing one award up to $1 million for Area 2. The goal here is to, number one, identify open health IT-based tools that leverage open standards as appropriate and could be enhanced or expanded for broader support and uptake, and/or, number two, identify needs for new health IT-based tools for research that require development. Next slide, please. The associated objectives for Area 2, we're looking at having Area 2 recipients conduct a landscape analysis to explore, identify, and describe current open health IT-based tools for research that could be enhanced and/or disseminated more broadly, and/or identify two or more research needs that would benefit from health IT-based tool development from the ones that are listed below. linking and aggregating research-relevant data sources with EHR data, improving the ability to match individuals to different data sources, developing tools to efficiently manage data use agreements, or DUAs, across organizations, developing functionalities that are needed to manage data across distributed sources, including identifying redundancy, account for updates to data and metadata, and analyzing data in different forms, supporting robust de-identification and use of de-identified data sets to increase confidence in security and manage risk, searching, indexing, and querying systems to identify patient cohorts or extracting data about research participants, or exploring consent tools that allow patients to control and update their data sharing preferences if embedded into the health IT infrastructure that could facilitate research participation and data sharing. Area 2 recipients must also work with ONC on a phased approach for the enhancement and/or development of open, scalable health IT-based tools to support research in coordination with relevant stakeholders, including but not limited to federal health research funders, users, developers, and the ONC Health IT Certification Program to advance their use in at least 2 of the health research needs identified above. Next slide, please. Applicant required expertise for Area 2 include health informatics and the use of IT and electronic health data for research, common data models used in research, for example, PCORNet's Common Data Model, or Observational Medical Outcomes Partnership, or OMOP, Common Data Model, the use of open data standards, research tools, and electronic health records, research tool development and use, including user-centered design and testing, and research enterprise and research processes such as DUAs and data sharing, patient matching and linkage, patient and data de-identification, patient consent and consent management, data aggregation, and identifying patients and participant research cohorts. Next slide. And finally, this is new to the LEAP in Health IT. We've added an Area 3 this year. We are looking at cutting-edge health IT tools to integrate healthcare and human services data to support improved outcomes. We anticipate issuing 1 award up to $500,000. The goal here is to improve electronic data sharing between healthcare providers and human services providers, using examples as USCDI, the U.S. Core for Data Interoperability, assessments such as functional assessments, items, and the electronic long-term support services, or ELTSS plan of care, advancing the role of the USCDI beyond healthcare settings to include human service programs, supporting real-world implementation of the ELTSS standard as part of federal programs with person-centered planning requirements, for example, the 1915C Medicaid waivers, document any improvements or modifications to the ELTSS plan of care and any associated specifications to support the integration of health and human services data as applicable, more efficient shared care planning of both health and human service providers to improve outcomes as measured by the Home and Community-Based, or HCBS, quality framework, and to document best practices in implementing the required technology in support of providing person-centered healthcare and human services. Associated objectives for Area 3. Area 3 recipients must provide data, reporting, and analytics that inform beneficiaries, payers, and healthcare professionals, provide data, reporting, and analytics that support research around the benefits, clinical, social, and financial, of incorporating healthcare and human services data into a person-centered plan, advance the value-based purchasing, or VBP, arrangements in Medicaid-funded home and community-based services programs, and inform the IT infrastructure and data sharing requirements necessary to create a VBP model in an HCBS program by relevant payers and providers, for example, states and health systems. Applicants under the area of 3 are required to have the following expertise: person-centered planning requirements in the context of home and community-based services, the role of health IT standards in data sharing, example, ESS Plan of Care Standard or USCDI, experience in using the ELTSS Plan of Care Standard, validating of standards in HL7, and principles of value-based payment programs, example, healthcare payment learning and action network categories 1 through 4. We'll just go over a brief background on the LEAP in Health IT NOFO. So the LEAP in Health IT NOFO was initially issued in 2018. This is a special emphasis notice under that NOFO. The purpose of LEAP in Health IT is to address well-documented and fast-emerging challenges inhibiting the development, use, and/or advancement of well-designed, interoperable health IT, which is scalable across the healthcare industry. Applications submitted under this special emphasis notice will be funded under the LEAP in Health IT Notice of Funding Opportunity, NAP-AX-18-003. Aside from the 3 areas of interest that we just went over, the required expertise and the deadlines under 2020 as listed in the special emphasis notice, all other requirements, application instructions, and the terms and conditions of NOFO NAP-AX-18-003 apply. Next slide, please. Eligible applicants. This is a competitive funding opportunity that is open to public or nonprofit private institutions such as universities, colleges, or faith-based or community-based organizations, units of local or state government, eligible agencies of the federal government, Indian or Native American tribal governments that are federally recognized or other than federally recognized and tribal designated organizations. For-profit organizations may participate in the project as members of a consortia or as a subrecipient only. Because the purpose of this program is to improve healthcare in the U.S., foreign institutions may participate in projects as members of a consortia or as a subrecipient only. Organizations that are described in Section 501c4 of the Internal Revenue Code that engage in lobbying activities are not eligible. The Health and Human Services grants policy requires that grant recipients perform a substantive role in the conduct of planned project or program activity and not merely serve as a conduit of funds to another party or parties. Applicant organizations may submit more than one application, provided that each application is scientifically distinct. Next slide, please. Key deliverables, as outlined in the NOFO. Each area of interest applicants will submit a draft project plan as an appendix to the application with corresponding table of key dates and milestones that ensure their objectives are met within the self-contained 2-year period of performance. Recipients will also conduct a virtual midpoint demonstration or update of any proposed approaches, prototypes, and/or enhancements to illustrate their progress on the selected area of interest that they are awarded for. And each area of interest applicant shall provide a deliverable table that consists of expected deliverables, which will be produced in support of execution of the cooperative agreement and the due dates. Next slide, please. So the 2020 Special Emphasis Notice deliverable table dates, draft project plan and timeline. Recipient will submit a detailed draft project plan that will include, but is not limited to, key milestones, identified risk and risk mitigation strategies, stakeholder coordination as applicable, and timeline that would be due no later than 1 month after the award date. Recipients would also conduct a midpoint demonstration or update of their proposed approach, prototypes, or enhancements. This presentation will be live virtual demonstration of their progress to date, and that will be within 13 months after the award date. Their midpoint specification revisions, revised project plan and timelines, if applicable, based on the milestone and project progress up to the midpoint, in addition to feedback from ONC from the midpoint demonstration, the recipient will submit a revised project plan and timeline and initiate any specification revisions as applicable. This would be due no later than 1 month after the completion of Deliverable 2, the midpoint demonstration. Deliverable 4, draft legal and policy landscape assessment. Recipients will be required to submit a draft assessment that addresses the impact of legal and policy factors on project goals, no later than 20 months after award date. Number 5, final legal and policy landscape assessment. Recipient will submit a final assessment that addresses impact of legal and policy factors on project goals, no later than 22 months after award date. And no later than 23 months after the award date, recipients will also be required to submit a final approach and, if applicable, prototypes. For example, computer software, including all associated codes and tools, and/or enhancements, as well as making prototypes publicly accessible for approval by ONC. Next slide, please. Key milestones. Developing an initial 2-year project plan, delineating components that will be completed in 2 years, as well as longer-term components if proposed. Establishing a technical expert panel to review research methods, results, and provide guidance. Implementing the plan to translate project outcomes into broader uptake. Scheduling and conducting, as appropriate, and participating in expert panel meetings, team meetings, and stakeholder meetings. Conducting and managing projects to the conclusion in 2 years. Conducting and managing the long-term projects to significant demonstrable progress in out years if awarded. And communicate findings through appropriate mechanisms and making them available as they are generated. Next slide, please. Funding, eligibility, and application information, and I believe I will now pass this off to Yolanda. No, okay, I'll keep going. So summary of some of the key details. For the special emphasis notice applications under LEAP in Health IT Notice of Funding Opportunity, this is a cooperative agreement. The total amount of funding is $2.5 million. We anticipate issuing 3 awards. Application due dates are June 8th, 2020, and we anticipate an award date of August 12th, 2020. Please note that this is just the anticipated award date and could be subject to change. The period of performance is 2 years, and our anticipated start date is August 12th, 2020. As mentioned before, we anticipate issuing 1 award per area of interest, with Area 1 and Area 2 being eligible for up to $1 million in awards, and Area 3 with an award of up to $500,000. Next slide, please. Letters of intent. Applicants are strongly encouraged, but are not required to submit a non-binding email letter of intent, or LOI, to apply. Again, this is strongly encouraged, but not required in order to apply. LOIs are due by April 27th, 2020. 11:59 p.m. Eastern Time. In your letter of intent, please identify the name of the applicant organization, your organization type, city and state. Please indicate this is for NOFO number NAP-AX-18-003 with the title LEAP Special Emphasis Notice, Applications to Address the Development and Testing for Data Sharing Functionalities to Support Clinical Care, Research, and Improved Outcomes. And I apologize, it's not listed here, but please indicate which area of interest you intend to apply for. LOIs can be sent to onc-leap@hhs.gov. Next slide, please. Application process. Applicants must submit all material electronically through grants.gov. This process is outlined in the NOFO. Again, they must be submitted through grants.gov. For assistance in submitting applications on grants.gov, please contact the grants.gov help desk at support@grants.gov, or you may call 1-800-518-4726. You must have a Duns & Bradstreet or D&B Universal Numbering System, or DUNS, number. Make sure to register in the System for Awards Management, or SAM, at www.sam.gov and allow a minimum of 5 days to complete the registration. If you are already registered in SAM but have not yet renewed your registration within the last 12 months, you must renew your registration. Again, please allow a minimum of 5 days to complete this. And make sure that the application meets the application requirements and page limits. Next slide, please. Application components. Applications must consist of a project abstract, no less than 500 words or less. Project narrative is limited to 35 pages. Your Form SF-424, which is Application for Federal Assistance, there is no page limit. Form SF-424A, Budget Information for Non-Construction Programs, no page limit. Form SF-424B, Assurances for Non-Construction Programs, no page limit. Form SF-LLL, Disclosure of Lobbying Activities, no page limit. Budget narrative, no page limit. And letters of commitment, if applicable, no page limit. Next slide, please. Your abstract represents a high-level summary of the project that can be understood without reference to other parts of the application, and that provides a description of the proposed project, including project goal or goals, objectives, overall approach, anticipated outcomes, products, and duration. The format we are looking for is no more than 500 words, double-spaced, includes your project title, applicant name, a physical address, contact name, contact phone number, voice and fax if applicable, an email address, and website address if applicable. Next slide, please. Your project narrative, which is limited to 35 pages, should address the elements articulated in the funding opportunity description, Section A of the NOFO, and adhere to the application and submission information under Section D of NOFO. Align the performance goals and milestones with the merit review evaluation criteria presented in the NOFO. Applications that did not follow the outlined format must be reviewed by an ONC designated official. The format we are looking for here, double-spaced and no more than 35 pages, formatted to 8.5 by 11 or letter-sized plain white pages in either Cambria or Times New Roman font with 1 inch or larger margins and a font size 11 or larger. Additionally, we under the project narrative, they must include the following components. Please note these components will be counted as part of the page limit. We've also provided suggested lengths of the sections which are listed below that are guidelines to help applicants create a balanced document but are not mandatory. Number 1, area of interest, vision statement, and key challenges, recommending 2 to 3 pages. Your proposed approach, 10 to 14 pages. Project team, 2 to 3 pages exclusive of the bio sketches. Number 4, planning for disseminating and transitioning appropriate research results into practice, 2 to 3 pages. Number 5, stakeholder coordination, 2 to 3 pages. Number 6, project management, 3 to 5 pages exclusive of project timeline and organizational chart. And number 7, organizational capacity, 2 to 4 pages. Next slide, please. So breaking it down a little further, your area of interest, vision statement, and key challenges. This section should offer the applicant's conceptualization of the selected area of interest. Should also include, from the applicant's perspective, a specific delineation of the objectives and research challenges the proposed project will address, specifically distinguishing between challenges that can be addressed in a self-contained project period of 2 years and future challenges requiring a longer period. This would be the additional 3 to 5 years. Applicants must clearly state which area of interest from the special emphasis notice that the proposed project will address. Next slide, please. Proposed approach. Applicants must provide a clear and concise description of the approach that you intend are proposing to use to conduct the research and development work, including identifying major challenges in the focus area and how to advance the field via proposed activities to meet the objectives of that specific research area. Proposed approach should be organized so that the relationship of each element of the plan to each of the areas of objectives and associated activities are completely clear. The development or employment of novel concepts, approaches, methodologies, tools, or technology, or combination of common research elements in an innovative fashion should be described, as well as how it will generate much needed insight to inform the field of health IT, and propose strategies on how the results of the project may be disseminated and transitioned to the field at large. Next slide, please. The approach should also include as much detail as possible given your page limitation. The plan for each activity at minimum must state specific aims, previous work of the investigative team on the proposed research is directly based, on which the research is directly based, the method that will be applied, anticipated outcomes of the work, and potential significance in addressing the challenges of the area of interest being addressed, and the key personnel who will be involved. Next slide, please. Number 3, your project team. This section must describe the proposed research team's experience and expertise that include the following: project director or principal investigator, also known as the PIPD. At least one person on the proposed research team must possess health IT expertise. For area interest 1, the proposed research team must have the expertise that was previously outlined in the SEN slide number 11 of this presentation. For area 2, the proposed research team must also include the expertise outlined in the areas of the SEN or on this slide number 14. And for area of interest number 3, the proposed research team must have the expertise in the areas outlined in the SEN slide number 17 of this presentation. The application should also include a biosketch for key project personnel. Next slide, please. Plan for disseminating and transitioning appropriate research results into practice. This section of your application should describe a plan for engaging health IT stakeholders and interest groups in promoting the dissemination and transition of appropriate research activities and the results into data standards, data infrastructure, health IT products, tools, and best practices. The plan should be specific in proposing activities that will disseminate and transition the results of the proposed self-contained 2-year projects in products and best practices, and collaborative arrangements with industry and other groups outside of the applicant institution should be accompanied by appropriate letters of support. Next slide, please. Stakeholder coordination. This section should describe plans to establish and operate a technical expert panel of relevant and appropriate stakeholders, including names of members who have committed to join or propose to join to help inform the work to be conducted in the relevant area of interest. Next slide, please. Project management. This section should include a clear delineation of the roles and responsibilities of the principal investigator, participating researchers, project staff, consultants, and collaborating organizations, and how it will contribute to achieving the research outcomes and objectives. If the application includes subrecipients with contractual relationships, plan for coordinating research activities across multiple organizations should also be described. This section should specify who would have the day-to-day responsibilities for key tasks such as leadership of the project, monitoring the project's ongoing process, preparation for reports, and communication with other collaborating organizations and ONC. And recipients will be required to maintain information relevant to proposed milestones and performance-based outcomes. Next slide, please. This section of the application should also describe the approach that will be used to assess project performance and to monitor and track progress towards key milestones. Finally, it should also include a detailed project timeline as an appendix that incorporates those milestones, and an organizational chart as an appendix that reflects roles and responsibilities. Next slide, please. Organizational capability statement. This section of the application should outline the established research program relevant to the research focus area and highlight established collaborative relationships with healthcare stakeholders. The statement should highlight potential strategies the organization may employ in an effort to sustain research efforts beyond the scope of the project timeframe, include relevant organizational resources available to perform the proposed project, for example, facilities, equipment, and other resources. Statement should also highlight capabilities of the applicant not included in the program narrative. And applicants for working with partners as part of a consortia must also provide letters of commitment from their proposed project partners. Letters of commitment shall be included with the appendices and do not count towards the 35-page limit. Next slide, please. Your budget narrative and budget forms. The following budget forms must be completed that document the cost of proposed project activities. Budget narrative on how the proposed project budget aligns with the applicant's project narrative. Application for federal assistance, Form SF-424. Your budget information for non-construction programs, Form SF-424A. Assurances for non-construction programs, Form SF-424B. And disclosure of lobbying activities, Form SF-LLL. Detailed budget instructions are provided in the NOFO. Next slide, please. And now I will turn it over to Yolanda.
Thank you, Tracy. I'm now going to review the application responsiveness and merit review criteria. The application review process. Applicants will submit all application materials electronically through grants.gov. Grants.gov will issue an email receipt upon successful submission. Applications are reviewed for responsiveness and categorized as pass or fail. All applications that pass the review for responsiveness are forwarded for merit review. Once the merit review is complete, ONC may make an award. ONC, however, is not obligated to make an award if none of the applications meet the intent of the program requirements or if there is a change in funding levels or availability of funds. The application responsiveness criteria. All applicants must meet the following completeness criteria or they will be administratively eliminated and not forwarded for merit review. The applicant meets the eligibility criteria. The application is received by the deadline of Monday, June the 8th, 2020 at 11 or before 11:59 p.m. Eastern Standard Time through grants.gov. The application contains all required components, for example, the program narrative, the SF-424, etc. The application meets all formatting and length requirements. Appendices and attachments are not used as a mechanism to exceed the page limits of the project narrative. The merit review criteria. Responsive applications are forwarded for merit review. Merit review conducted by a review panel of at least 3 experts in their field from the academic institutions, nonprofits, local and federal government agencies. Applications can receive a maximum of 100 points using the following scale. Understanding the project purpose, 10 points. Approach and activities, 40 points. Applicant capabilities, 30 points. Budget, level of effort, and justification, 20 points, totaling 100 points. The first merit review criteria is understanding the project purpose, worth 10 points. How well the application addresses the purpose and objectives of the SEN is identified and identify a specific research area of interest. To what extent the proposed project and activities parallel SEN goals and the objectives associated with one of the 3 identified areas of interest. The extent to which the applicant has identified an important, coherent, and promiscuous set of challenges and associated research questions within one of the 2 identified areas of interest that are, or if not addressed, will be clear barriers to advancing interoperability and or advancing clinical knowledge at the point of care. The extent to which the applicant describes how the project and expected outcomes and or results will inform the field and future health IT development, research, implementation as appropriate. The second criteria is the approach and activities worth 40 points. The extent to which the proposed research method promised to address the challenges with breakthrough findings on the proposed timeline within the parameters of a self-contained 2-year project period and potentially longer project period is funded. That's 20 points. The extent to which the applicant proposed a clear and detailed transition dissemination plan. The extent to which the plan to transition disseminate results to products and best practices is complete and feasible, and envisions the release of the outcomes of their research into open source communities. That's worth 15 points. And the last 5 points, the extent to which the plan describes a project management approach for ensuring project success within and across collaborators. The next criteria is applicant capabilities. Strength of evidence that the project brings an appropriate level of research and technical knowledge and expertise. For the chosen focus area and strength of evidence that the project will integrate the efforts of those team members is worth 20 points. The extent to which the proposed activities bring all the resources necessary to perform the proposed work and the identification of proposed strategies to complete activities within the 2-year time frame and sustain research efforts beyond the project time frame is worth 5 points. The last 5 points is the extent to which the scientific environment or environments in which the work will be done contributes to the probability of success, employs useful collaboration arrangements, and has evidence of institutional support. The last 20 points will be covered under the budget, level of effort, and justification. Is the use of consultants and or subrecipients appropriate and adequate to advance the project in accordance with the time frames? That was worth 10 points. The extent to which the budget is justified with respect to the adequacy and reasonableness of the resources requested and the amount of the budget allocated to administration is minimized while still allowing coherent management of the integrated project is worth 10 points. Last, I will turn this over to Derek to answer or to address questions.
Thank you, Yolanda. All questions must be submitted in writing, either via the Q&A function during this webinar or email to onc-leap@hhs.gov. Questions submitted during this event will not be answered today. All questions will be answered in the form of an FAQ and be made publicly available each Monday at www.healthit.gov under topic ONC Funding Opportunities, Leading Edge Acceleration Products, LEAP Notice Funding Opportunity. We thank you for attending today's event. We will remain on the line for 5 minutes. Please submit any remaining questions via the Q&A function on this webinar page. To see the SEN on grants.gov or to apply, please go to www.grants.gov/web/grants/view-opportunity.html, opportunity ID 306704. For assistance with submitting applications in grants.gov, please contact the grants.gov help desk at support@grants.gov or call 1-800-518-4726. There are now 5 minutes remaining. Please submit your questions. You now have 3 minutes remaining to submit your questions. There is now 1 minute remaining to submit your questions. Important dates to remember for the SEN 2020 competition are the NOFO release date of April 6, 2020, the informational session of April 15th, 2020, the letter of intent date, which is due April 27th of 2020, the application deadline of June 8th, 2020, and the targeted award date of August 12th, 2020. The moderator will now end this session. Thank you for attending.